Hello and welcome. Very happy to have you here today. If we haven't met, my name is Dr. Arnie Angrist. I'm a wellness chiropractor, wellness expert, doctor, teacher, mentor, coach. I've been in practice for 40 years. This year will be 40 years in practice in New York and New Jersey. And I'm thrilled you're joining me today. I'm so passionate about helping others achieve their goals, which is why I'm a health coach and a wellness chiropractor. I love the personal interaction that I get to have with each of my patients and clients. And we'll be using interchangeably those two terms, patients and clients, because I work with patients in the office and people that we work with, that we coach, are considered clients. So I'm really excited to tell you more about what I do. If you have any questions during our time together, please feel free to post them, and I will do my best to respond quickly to them. Okay? So again, welcome. This is my information, who I am, where I am, and if you have any questions, please do not hesitate to call. So today, the current healthcare landscape, we're going to be doing this PowerPoint presentation, and we'll begin with this. And think about your last doctor's visit. How much time did your doctor spend with you? Did you discuss health habits, nutrition, your lifestyle, and activity levels? Did you get into all that? Or was it mostly about the symptoms that you have and what medication they could possibly prescribe for you to suppress those symptoms? So unfortunately, the answer is no. Most doctors only have a few minutes to spend with each patient. Not that they don't want to spend more time, but they just don't have the time. Doctors today are trained more on sickness, not on wellness. Coaching and alternative healthcare approaches are about wellness. So we're in what's called a healthcare system. I really call it a sick care system. And the goal is to try to stay out of the sick care system and stay healthy, well, be proactive, be preventative. And again, that's what this is all about. Unfortunately, most conventional, traditional medical doctors aren't trained in the skill set of how to develop a long-term plan to keep you healthy and motivated while holding you accountable. So really, really important, and that's the hard part. It's easier to go to somebody else and have them take care of it. I always hear this four-letter word called it's hard. Everything is hard. It's hard to stay healthy. It's hard to be healthy. It's hard to be successful. It's hard to build relationships. Work is hard. Life is hard. And that's just the story. It's how you deal with it. And we will talk about that. So exactly what does a health coach do? The primary goal of a health coach is to help patients achieve their health goals. So what's your goal? What do you want? So I can't tell you what you want. It's really only about what you want. Coaches mentor, inspire, guide, and motivate to cultivate better, more positive health choices. Health coaches provide guidance and management in the major components of health, including diet and nutrition, physical activity, and overall wellness. Simply put, health coaching is a collaborative effort between the client, the patient, the coach, the wellness practitioner. And some examples of a health coach's role can be assessing your current health condition, obviously, developing health goals for the client or patient, providing counseling services, documenting your progress, and establishing a client's, your plan of action. Little overview. The best available research evidence bearing on whether a treatment works and why. So there's so much confusion out there with information that's so contrary. And it's really a matter of making better choices. I act as a filter for people to understand common sense, simple to implement ways to make yourself healthy. And if you do know me, you know that we always start from the mindset, the way you think. And the way we think controls everything else. And that's vital to being healthy and to being well. Number 2 is an expertise to identify clients' individual health state. Where are you at right now? And the risks involved. And then also, what are your preferences and values? Again, it always will come back to you. It's what do you want? It's not what I want. It's not for me. It's for you. So always understand that. And we tend to not really be as accountable as we can be and responsible. None of us are perfect. Perfection actually creates rigidity in the body. But I do say the key is to be, or try to be, outstanding and or excellent in everything that you do. So for those perfectionists out there, I know it's important to do everything right, but we can't. And that's the part of the letting go, and those are a lot of the things we talk about in order to get your health back. So some credentials: there are health coaches and life coaches and chiropractors and nutritionists and alternative practitioners. I think the key with going to any coach, whether it's me or anybody else, is that they have life experiences. And I've been in practice 40 years, not only treating many conditions, but really hearing the stories, the sagas, the rationalizations, the excuses, the negativities. And you need somebody that listens. That's why God gave us 2 ears and 1 mouth, so we can listen twice as much as we talk. We need to listen more. It's a very, very important part of what I do, is to listen to what patients have to say. And then hopefully we can get in there and motivate you and get you on that journey. It is a journey. It's not a destination. The client coach process. So there are 4 steps basically. And the first step involves establishing a relationship. Building a trust through rapport is essential for a successful client-coach relationship. And when I was in chiropractic school 45 years ago, one of the first things I learned when I was getting out of school was the key is get the 2 R's, have the 2 R's. And the 2 R's are build relationships with your patients and clients. And the second R is get results. We have to get results. People have to get better. If people don't get better with what we do, we have to refer them out to find out why they're not getting better. But if we deal, which we do, the emotional, the physical, and the nutritional components, usually we have a pretty good chance to get that mind and body working, getting back on track the way it should. The second step is interviewing for building a strong communication strategy. And this step helps clients become aware of personal problems and our own self-limitations. The goal is to focus on the present and explore the individual's core value and goals. And living in the present is another key to health and wellness. And as Deepak Chopra says, the past is history, the future is a mystery, and the present is a gift. That's why it's called the present. And so many of us go into the past and worry about the past or worry about the future. You can't control it. We can learn from the past, but we can't do anything about it. We can only live in the present and keep improving every single day. As I said before, none of us are perfect. We need to grow. We need to improve ourselves. And that goes through the mind, goes through the body. We can eat better. As I say, we can eat better, think better, and move better. And if you break those 3 down, that pretty much explains everything. How can I think better? How can I eat better? And how can I move better? And that creates a whole person. Third step is creating a wellness vision. What's your vision? Which includes physical, emotional, social, spiritual, and financial realms of your life. A wellness vision is used to help clients reach optimal well-being by connecting them to their own truth and wisdom that is held within. I was saying, if you don't go within, you go without. So it's really about introspection. It's about really getting serious about yourself. At the same time, having levity, enjoying life. One of the keys to health and wellness is humor. To laugh, to surrender, to let go, to not take things so seriously. Kids, when there's a rainstorm and there's a puddle, what do kids do? They go right through it. They laugh, they giggle. What do adults do? Oh my God, it's raining and I better go around the puddle. Serious, intense. That's what creates so many of the problems that I see, is that mental attitude of tension and stress. And again, we all have stress. It's how we deal with the stress. And the fourth step is setting goals. And a lot of people have set goals, whether it be in their minds, on paper, and especially New Year's goals or summer goals. And the hard part is keeping the goals. And that's the key, is to make things that are, not that they're simple, but that you can attain them. You can reach those goals. They make them real. Okay? The coach will help the client by acting as a guide through this goal-setting process. It's a collaborative step between client and coach. And setting appropriate goals is crucial when helping clients achieve wellness and success. And the role of the health coach offers support for your self-management. This can include providing educational resources and helping problem-solving books, referrals, and recommendation. I have so many books on my book list that I read, that I recommend to people to read, about health and wellness and nutrition and exercise, and simple tips to just hopefully make a change. It's all about, even though I'm a chiropractor, wellness chiropractor, I really call myself a pattern interrupter. That's my job. How can I interrupt patterns based on what I do to get you to feel better? But then how can I interrupt patterns in you so you start thinking differently, acting differently, and therefore leading to that R called results. A health coach can help clients become well-versed in the healthcare system and medical resources. Like I said, is it a healthcare system or a sick care system? And most people go through the sick care system. And that's what we're trying to avoid. We want to avoid pills and drugs and opioids and hospitals and just get your mind and your body clean. Doesn't mean there isn't a need. There's a definite need for all of that. But the goal is to stay away from that as best we can. So, and how important is health coaching? To me, the future of healthcare is reshaping, with the focus moving from treatment to prevention, or from what I call illness to wellness. And there's a spectrum. And either we're moving in one direction or another. So if you can visualize a spectrum linearly of, at one end is illness and the other end is wellness. And you're at some point in that. Are you closer to wellness or are you closer to illness? Are you moving towards wellness or are you moving toward illness? And that all depends on your lifestyle habits. And if your lifestyle habits are really good, chances are, even as you're getting older, we're all getting older every single day, we move toward wellness. So even if we took flexibility as an indicator, when we're kids, we're totally flexible. Most kids are pretty healthy and well. When people are older, 70s, 80s, 90s, what happens? Even in 60s, we lose flexibility. So that, to me, is moving in a direction of illness, just a lack of flexibility. It's not a serious illness. It's a quality of life-threatening condition. It's not life-threatening. But people feeling as they're getting older, I feel stiff, I feel tight, it's my shoulder, it's my back. That's moving in a direction of illness. You want to move in a direction of wellness. That's being flexible. It's being aligned. It's being balanced in our lives, emotionally, spiritually, nutritionally. It's being FAB, F-A-B. Be flexible, aligned, and balanced. So coaches have a committed focus on healthcare, on holistic healthcare. And we have the unique ability to focus on that based on what we do. Coming from a paradigm of the body, your body has an amazing ability to heal on its own. If you have a cut, it heals from within. If you have a cold, your body heals. If you have a fractured bone, a hairline fracture, obviously you have a more complicated fracture that requires potential surgery, things like that. But a simple fracture heals from within. So when I treat back problems and neck problems and headaches and plantar fasciitis and fibromyalgia, I believe right from the get-go that your body has this amazing ability to heal. The problem is many patients don't. They don't understand, I need some kind of a pill. Pill doesn't get your body to heal. It might suppress some symptoms, treat the symptoms, symptomatic relief. But the goal with health and health care is getting to the true cause. And the true cause is all the stressors in our lives that create this. But when we do have a condition, a little time, a little therapy can many times get your body to start working the way it's supposed to. So holistic health is defined as an integrated approach to healthcare that treats the whole person, not simply symptoms and disease. And we are in a society that we treat symptoms and disease. Even people come to me not as a preventative, they come to me preventatively after they've learned that preventative is a good way to go. But most people start off by going to somebody, even if it's a cardiologist, that their heart maybe is beating rapidly or their digestive system's not functioning the way it should, so they wait until there's a problem. So if the goal is treating a system, you're a whole system, a whole person, not a symptom. And if we could shift that paradigm, you're not the condition, you're not the label, you're not the diagnosis, you're much bigger than that. And it's getting to understand that and getting to trust that. It's a hard thing to trust. I don't even ask for patients to trust me. Trust yourself. Trust that your body has that amazing ability to heal, to bounce back. I always say there are setbacks, which we all have in life, but there are bounce backs. How well, how quickly do we bounce back from that setback? And generally we do. And we need help sometimes. We all need help. To do it on our own is difficult. But again, it doesn't mean taking a pill or a drug for it. It could be coaching. It could be an alternative approach. It could be somebody ushering you along to help you understand that your body's going to be okay. And if it's not, then more drastic, more invasive procedures have to be done. Absolutely. Making a personal connection by understanding the psychological, behavioral, and emotional needs of clients, a health coach can provide a truly personalized, one-on-one, client-centered experience. So those are all the emotional components and the mind-body connection. And there's what's called the triangle of health. And in the triangle, at the base of the triangle, if you could visualize the structural, the physical part of our bodies that holds everything together. And on either side of that triangle is the emotional or spiritual side, psychological side, and on the other side is the chemical or the nutritional side. And they all touch each other because they're all connected. But based on what I've learned, the emotions control so much of what goes on chemically or nutritionally with us, with our choices, with our symptoms, and physically. So many of the back problems that I treat aren't really back problems. They're really emotional issues, emotional stressors that manifest in certain physical parts of the body. And that's a hard concept for a lot of people to grasp. Like, I have back pain or a shoulder pain, it's right there. But the key is, where is it coming from? The presenting problem is not always the problem. So if somebody presents with a problem in one area, that doesn't mean where the actual true cause or problem is. And that has to be addressed. And somebody that has the expertise can help you find that. For example, if it's called compensation or adaptation, if I put a pebble in your shoe at the beginning of your day and you were walking around with that pebble, you couldn't take it out, eventually by the end of the day you'd be agitated, you'd be irritated, you possibly could have some hip pain or back pain because of that, because of the way your body's adapting to that. So everything is connected. So SMART goals. SMART is an acronym that stands for specific, measurable, attainable, relevant, and time-bound. And I try to simplify that with what I call the 4 questions. And the 4 questions are, what do I want? So what do I want? For example, somebody can say, I want to lose weight. Why do I want it? I want it because I'll look better, it'll make me healthier, I've been getting back pain because of my weight. Okay, so what do I want? Why do I want it? By when am I going to get it? By when? By the end of this year, I'm going to lose 12 pounds. And then the 4th question is, how am I going to do this? What action steps am I going to take? Excuse me. So those 4 questions, what do I want? And this could be for anything. What do you want? It's not about what I want. What do you want? Why do you want it? By when am I going to get it? So you put a time frame on it. And then most importantly, what action steps are you going to do to get that? Because it always takes action. You know the expression, knowledge is power? I don't believe knowledge is power. I believe knowledge plus action is power. So smokers, if I asked 100 smokers, do you know that smoking is hazardous to your health? I think 100 out of 100 would say, yeah, I know. But they don't take the action to stop. For whatever reason that is. And that gets into the psychology of why it's so difficult to change, or as I used that four-letter word before, hard. So hard. And it is, it's hard. So the goal is to set these goals, but to not overanalyze these things. Got to figure everything out. Take it easy. Go slow. Allow. Takes time. It's a journey, not a destination. But that word analyze, I break that down into analyze. And when we start analyzing things, that's when we get into trouble. So understand the process. Understand things take time. Everything takes time. Building a career takes time. Building a relationship takes time. Being healthy takes time. Everything takes time. But the other problem is we're in a quick fix society. So we always want it right now. And health care, alternative health, natural health, wellness is about over time, taking care of yourself. Most of us, I hope, brush our teeth every single day. We don't say, I'll brush my teeth 20 times today so I don't have to do it for the next week. It's about being consistent. As Tony Robbins says, CANI, C-A-N-I, constant and never-ending improvement. And that's what we need to do. We need to continue to grow and improve and be better versions of ourselves. And that's really the goal as we get older. Retraining our brain. So our brain is obviously one of the key organs in our body. And one specific technique is to help patients, clients identify negative thinking patterns about themselves and their health to change how they look and feel. So how we think definitely affects how we look on the outside. If you're a beautiful person, you come from a place of loving, caring, giving, and kindness, you're going to look better on the outside. If you come from a place of negativity and judgment and criticism and fear, I think it takes its toll on how we look on the outside. So if we could learn simply just to be more loving, caring, giving, and kind, and I would hope everybody watching this is loving, caring, and giving, and kind, but we can raise the bar and be more loving, caring, giving, and kind. That's the key. And the brain, the mind, controls the physical and the chemical and the emotional and the nutritional. So you want this brain to really be working, to be optimistic, to be happy, to be generous, to be caring, to help others. And that's for you to work on. But providing the right tools to get there is vital. So retraining your brain to think more positively does take a lot of work, but it's so effective. By shifting your focus on the positives rather than the negatives, your health outcomes will change as well. So an example, instead of saying, I hate to exercise, remind yourself, you know what? After I exercise, I feel really good. And over time, your brain will automatically shift to a more positive way of thinking without much effort at all. So are you ready to experience the power of positive thinking? I do affirmations every day. And one very simple one is, today is a great day. Today is a great day. And I have the opportunity to show up as the best me ever. So today is a great day, whether it's raining, whether it's cloudy, whether it's snowing, whether it's cold. It doesn't matter. Today is a great day. I'm here. I'm alive. And I have, not anybody else, the opportunity to show up as the best me ever. So that's all I try to do. Again, I'm far from perfect, but it's about doing the best that we can do. And if we can do that, and we grow from that, I believe we can be healthier, we can have more energy, we can be more vital, we can be more productive, rather than all the blockages. Just even using the word hate. I hate this. It's such a powerful word. I believe it blocks energy. And healing and health is about energy. Kids have great energy. And as people get older, their energy goes down. You want to have that energy going. your entire life. Life should be like a candle burning brightly until at the end, whenever that end is, it just flickers once and goes out. How many people do you know and I know that their lives are flickering for years? Whether they're somehow functioning in life, or they're older and they're in a nursing facility, a nursing home, and they're just existing. I've experienced that in my own life, and I'm sure many of you have. So getting this brain on track and understanding that and how to deal with that helps you make better choices. And when you make better choices, again, they don't have to be perfect choices, but they have to be better choices. Move better, think better, eat better. It just brings us to a better place. Becoming self-reliant. It's important to understand we all have the power to be responsible for our own health. And Tony Robbins, who was a patient of mine years ago, has many books. One of his books was Awaken the Giant Within. So Awaken the Giant. He has a book called Power also. But we all have a giant within us. We just suppress it. We push it down. We sabotage it. But the goal is to get that power out. Just by me doing these talks, these webinars, lectures, talking to patients, teaching patients, clients, it's empowering to be able to at least say what we want to say. And each of us has that within us. And whether it's finance, whether it's real estate, whether it's in the arts, wherever it is to express ourselves. And there's two versions, expression versus suppression. And we're in a society that spends so much time with suppression, emotional suppression, chemical or medication suppression. And the key again to being healthy and well is expression, to express yourself. If you're in a healthy relationship, are you suppressing your feelings or are you expressing your feelings? You're expressing them. What we do, what a therapist does, is to draw out the tension. We want to get rid of that tension from within and pull it out so the body is freer and the body works effectively and efficiently. Healthy lifestyle habits can last a lifetime, and that's the goal. This is not a 6-week program to just help your body and mind and you stop. It's a lifetime. My job is to get people started on it, and therefore you then can take over. You've got to understand the things you need to do. People, again, need help along the way, but it's getting that right foundational mindset to get started to, as I said earlier, to interrupt some patterns, change some habits, make new lifestyle choices. The better care you provide for yourself, the better you can care for others. So we were taught as kids not to be selfish, but I think we have to be selfish about our own health. So think of an example on the plane when you're flying with a child and the flight attendant says, if we need the oxygen masks, make sure you put the oxygen mask on you, the adult, not the child. Some people say, I better save the child. But you have to save and protect you. If you're a caregiver for anybody, you've got to take really good care of you. Why? In order to take care of anybody else. I give lots of lectures to caregivers because my wife is a geriatric social worker, and we talk to the caregivers, and I do not talk to them about how to be a better caregiver. I talk to them about how to be a better person, how to be a better human being, how to be a healthier human being. Because if you can do that, you can be a better caregiver, have a lot more tolerance and a lot more love because it's so stressful. Just like taking care of a child can be stressful. Or you can really take care of you so you become this really loving, caring, giving parent. So behaviors such as the foods you eat, the amount of sleep you get each night, and how physically active you are have a major impact on your health. And each of these behaviors can either positively or negatively affect your overall health in significant ways. But ultimately, a health coach can support you to take ownership of your experience and create positive, lasting lifestyle change. And I said before, if you don't go within, you go without. Another example is where we point our finger, we blame everybody else. It's their fault and it's the universe and whatever. But if you point your finger, just look at your hand, there's one finger pointing away, but there's 3 fingers pointing it back at you. And it's about you being accountable, you changing your lifestyle habits. So let's talk a little bit about this chronic disease epidemic we're in. And today, chronic disease attributes to 7 out of 10 deaths in the United States. So we want to avoid this. And what are the chronic diseases? Heart disease tops the list, right? Followed by cancer, chronic lower respiratory diseases, stroke, and diabetes. Those are 5 killers. And many contributing factors to these diseases, believe it or not, are preventable. For example, lifestyle influences such as diet and exercise and mindset definitely are the keys. And health coaches and mentors and alternative practitioners, that's what we address. So, weight loss. The Center for Disease Control and Prevention, the CDC, reports that over 1/3 of American adults are obese. Another 1/3 of American adults are overweight. So approximately 66 to 70% of American adults are either overweight or obese. 66 to 70%. Children at least have less, but still way too high. 17% have obesity. So why is that? And why are the numbers getting worse? What's going on? What are people eating? Why are people not exercising? What's going on with the stress that's blocking the way they think and the way they make choices? And that's where people need help, natural help. There are drugs, I'm sure, for losing weight. But is that really the answer? Does that just mask the symptoms? There are surgeries performed. And sometimes those surgeries can be a godsend as long as you're willing to make those changes. You have to make those changes emotionally in order for them to even do the surgery, perform the surgery for you. So, obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. Some of the leading causes of preventable death. Many studies have shown that health coaching to be effective in helping individuals lose and maintain weight, and in turn, lowering your disease risk. 2 biggest risk factors in health: being overweight or obese. 1, 2, smoking. So if you're not overweight or obese and you don't smoke, you got a pretty good shot at really getting healthy. Even if you do those, you can stop, but it's only when you're ready. I can't tell a patient or client, okay, you need to stop smoking, or tell somebody that's anorexic, okay, you need to start eating. It doesn't work that way. It's about you being ready to interrupt those patterns. When are you ready? When will you be ready? And that's only you can answer that. So heart disease is the leading cause of death for both men and women. 610,000 people die of heart disease every year, which accounts for 1 of every 4 deaths. And it's the leading cause of death for both men and women. Some of the risk factors for heart disease include high blood pressure, high cholesterol, and smoking. That's why yearly physical examinations are really important to see where you're at with those numbers. The sad truth is nearly 50%, probably more, of Americans have at least one of these 3 risk factors. And some other lifestyle factors also put people at a higher risk for heart disease include overweight and obesity, poor diet, physical inactivity, and excessive alcohol use and abuse. Dr. Sanjay Gupta recently did a special on CNN about stress and about alcohol abuse and about opioids, and it's just really a great 1-hour presentation on what stress is doing to our lifestyle and what it's doing to our quality of life and our life expectancy. I recommend you get that on demand if you can, Dr. Sanjay Gupta on stress. Lower your risk for certain cancers. Cancer is the number 2 cause of death in developed countries and number 1 in underdeveloped countries. Scientific experts worldwide agree that at least half of all cancers and cancer-related deaths are preventable, whereas only 5 to 10% of cancer cases have a genetic link. So we tend to think, oh, it's in my genes, but it's really in your lifestyle. There's a study of what's called epigenetics, which shows that by eating poorly, emotional toxicity, which is negative thinking, stinking thinking, that changes our genes, and that's a cause for a lot of the sickness and illness. So it's not just oh, it's in my genes and I can't do anything about it. You can be accountable. You can make changes if you're ready and willing. When it comes to cancer, what you eat matters. The most common cancer-causing foods include refined sugar, flour, soda, microwave popcorn, food in cans produced with BPA, bisphenol, which is plastic in bottles, grilled or processed meat, and hydrogenated oils. The food choices you make every day can raise or lower your personal cancer risk, and a health coach can help you remove known offenders from your diet. There's so many books out there on health. One book that I promote is called Food, and by Dr. Mark Hyman, and it's What the Heck Should I Eat? And he really breaks down in each category, every food group, as to what you should eat. I highly recommend that to take a look and see what can I change? What do I buy into? There are certain things that are said, whether it be by me or any doctor, practitioner, coach, that you have to ultimately make a decision. Caveat emptor, let the buyer beware. So there's so much, as I said, information, confusing information. What makes sense? What's common sense to you that can really make a difference, that you can grab onto and really understand that, hey, I can do this to make a difference in my life. Chronic lower respiratory diseases do not need to be in your future. And it's called COPD, and it's the third leading cause. And smokers is the number one cause for this. And the goal is for smokers, how can we help smokers to quit? Like I said earlier, you can't tell somebody that's a smoker to just stop. You've got to get ready. But there are a lot of things, foundational steps you have to plant first in order to get to that point. Stroke. Stroke's the fourth leading cause of death and the leading cause of serious long-term disability in the U.S. Nearly 1/4 of strokes occur in people under the age of 65. And studies report that many stroke survivors admit to feeling overwhelmed by the treatments recommended by their healthcare providers. Evidence shows that participation in programs that teach self-management skills and education can improve quality of life and self-efficacy after stroke, and which is where a health coach can help significantly. Diabetes improvement. CDC reports type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes in adults, but again, is largely preventable. 1 out of 3 adults has prediabetes. However, 9 out of 10 of these people don't even know they are pre-diabetic. And some significant risk factors for diabetes are age, excess weight, especially around the waist, family history, physical inactivity, poor diet. So those are diseases that we don't want to have, but yet so many Americans do have these. And that's the goal. And even if you do have it, it's what do you do at that point to try to change it? What approach do you want to take? So, of many references, what we talked about, you can observe those, take a look at those. That's where we get this information from. If you have any questions, you can call me. I want to thank everybody for joining me today. And I do want to give you an offer as to how I can possibly help you. But as it says there, it is your personal responsibility to take care of your own health. Whether it's me or someone else, I think we all need help. We all have accountants or lawyers or doctors or team members to help us navigate through this game of life. And the game of life, as I said, is hard. It's a challenge. But if you can do things right and come from a place of love, it certainly makes it a little bit easier. So here's my offer. And if you're looking for a new and different solution for your lower back pain, your neck pain, your headaches, your fibromyalgia, your plantar fasciitis, or whatever physically you might be suffering from, that's not pathology, it's not a disease, illness, we can hopefully help you. You have 3 choices when it comes to treating your condition. Drugs is one, surgery is another, and the third is therapy. Whether it's therapy that's considered chiropractic, acupuncture, massage, yoga, Pilates, coaching, mentoring, nutrition, Alexander technique. Those are all forms of therapy as compared to simply drugs or surgery. So if you're one that would prefer the drug approach to cover it up, the surgical approach, and obviously those are necessary at certain times, not all the time. But if that's what you prefer, then this type of process of coaching isn't for you. The goal is to stay away from those medications if you can. The goal is to prevent surgeries from happening if you can. Again, if they're necessary, it's the caveat. If they're necessary, then that has to be done. But this is coming from a natural approach. So, if you are searching for a proven, non-invasive therapeutic approach to treating these physical conditions that you have, we have answers and solutions for you. With 40 years of experience in private practice in both New York and New Jersey, I feel I can provide you with a very clear path to reduce or eliminate your pain. What I can offer you is me, one-on-one, superior personal service to treat you, teach you, coach you, and support you. I would argue that it is your personal responsibility to take care of your own health, not for our health to be taken care of by a third party. And that could simply be an insurance company. Many people come in and say, I've got a $15 copayment and my insurance will cover it, and there's no accountability to their health. We try to attract people that are accountable. As I said, nobody's perfect, but the more accountable you are, the better the results there are. The crux of the sick care model today, of the healthcare model, is that we want insurance to take care of us and restore in us what our own bad lifestyle habits and choices have actually created. So I really look at it as you have to decide, is getting healthy a cost to you or an investment in yourself? And if you look at it as a cost, somebody says, I only want to pay for my copay and I only want to spend this much, then again, this is probably not for you. If you look at your health, your life as an investment in yourself, then you're going to spend the money doing the things you need to do to get healthier. Okay, so it's a choice. And we just want people that are attracted to us that really have that kind of mindset. So here's my offer to you. I'm offering online 4 30-minute sessions over a 4-week period with me and only me. And this supports you through the process of helping you reduce pain and recapturing and regaining your health. By me making suggestions, you doing things, you being accountable to do what I ask you to do. My personal guarantee, though, is if you really don't feel better after these 4 sessions, I will invite you into my office at no additional charge to have 4 office visits that will include a thorough physical evaluation of your spine, nervous system, muscles and discs, joints, as well as soft tissue trigger point therapy to treat these areas and ultimately resolve your problem. If x-rays or MRIs are necessary, I will recommend them and you would be referred out for those. So the offer is, for all of that, my fee for this service for a month is $600. During the month of April, I will offer you a special, up until April 30th, a special of $400. If that's something that works for you, then that's great. The value of what we provide, I believe, is outstanding, and we're about making change, interrupting patterns, as I said. So if you're ready, when you're ready, you give us a call. You have our contact information. I've been doing this for 40 years. I'm here to help you. If this doesn't work for you, it's okay. It's all good, and I wish you only good health. Be well, and thank you so much for listening, and have a great day. Bye-bye.